did not validate actual practice. So the study specifically assessed internal medicine attendings, residents, and interns' knowledge on preventive strategies. So the best case scenario would have been to go back into the medical charts and see if it was documented, or an additional way to do it was to do exit surveys. So ask the patient, and he's walking out of the hospital saying, hey, do you do this, this, and that? So the study is definitely subject to induced response bias, and the way we did it to avoid or to try to decrease that type of bias is we presented the trainees with scenarios. So say, for example, you have a 50-year-old healthy male that walks into your clinic. What would you do? And we put in a couple of questions there, like to try to diminish the source of induced response bias, but it's certainly there.
Muchísimo.
Yeah.
Enormemente. Yo pienso que si tú realizas, si tú haces un estudio y le preguntas a los pacientes o revisas las historias clínicas, la imagen va a ser totalmente diferente. Lo hemos hecho en varios países en América Latina.
It depends on the objective of the study. And the objective this time of the study is to increase training for them. And the study yield that they need additional training. The study yield, the guidelines of the Ministry of Health are far from any better, are far from good. And that once they are trained, we can go on and see if they're actually complying. But we can't go and see if they're actually doing what we don't know if they have even been trained. And we don't know if the guidelines for the Ministry of Health are actually good. So we agree with you, but you're one step ahead, because I'm assuming you're already trained the interns. Otherwise, it's obvious that it's going to be bad.
The prevention of risk factors, as presented by all the speakers, is complex and involves almost all segments of the society. And even in the medical area, involves different sectors. But I am thinking about what is the special role of the academies of medicine. Because the academies, medicine or science, usually major responsibilities provide scientific-based advice for the society, for the government, and even to raise necessity of increasing the research in this country, not only to bring the knowledge, international knowledge to the country, but also to see if the country is doing some research. So my idea is to ask the panelists what they believe is the role of the academy in each of our countries.
I was requested to get 2 or 3 questions together before opening the round for the speakers. Is there any other question? Professor Meier has an interesting one for the rest.
I would like to ask to the Dr. Fernandez Brito to what he thinks about if politics influences the results that he has in Cuba about the health system. Because there is a lot of discussion in this area. If some systems are better than others in the result, quality of life of the people.
And finally, I would like myself to pose another issue on the table. There is a big asymmetry in the continent for this, for the organization of the health system, for the quality of the attention of the problems, from the very specific care for details in Cuba to, for example, the situation that we heard about Guatemala. So there's a very big asymmetry, big differences between our countries. I would like the speakers to take the 3 comments into consideration for their comments. goes first?
Take the first shot at the Academy of Sciences role. I think the number one issue that comes to mind is become politically active. Data is pretty good. It's very good to publish. It's good for your CV. It's good for your ego. But if we don't get it to the actual stakeholders, we won't change anything. And I think more and more funding agencies are starting to ask for that next step. So you did the project, you published the project, it's in the peer-reviewed literature, so what? So I think it's a complicated process, it's not an easy process, but I think we need to get started early in the process by communicating with policymakers saying, hey, what's the real burning issue right now in Congress? Maybe they're going to say, don't even talk about cancer right now. Or maybe they're going to say, the first lady was just diagnosed with breast cancer, and that's the issue we should be taking on. And then from a researcher perspective, going after that question and add those experts to try to do that push and pull strategy in which the researchers are feeding the policymakers and the policymakers are using that data to move evidence forward. And I think Academy of Sciences, given that they're apolitical in the sense that they're not affiliated with any party, are in a perfect situation to say, we have credible data. We're not for or against this party or for or against this company. We're just showing the data for you to move it into policy and for the evaluation once policy has been implemented.
A ver, the role of the academy of each country depends on the organization of their country and the organization of the academy. We said that the human beings, the person, is the same when he's working in the hospital, when he's working in the consultation, when he's going to the movies, and when he's working for the academy. So the direction of the academy itself, the leader of the group, is have to find the organization and to put the idea and to collect the group according to a specific point of view to discuss. Because the person, we are more or less dissimilar and we live in different activities in the world. So if the academy asks to the academician for that work and the direction of the academy, the board director of the academy is able to join a special group dedicated to the specific theme, then the result will be much better. But the idea has to come from the up of the direction of the academy to the people who have to do the work. We cannot depend that the basis of the people itself, that they have to organize something, because the people is completely doing what they are doing every day. So we have to be collected, to have to be asking for the direction of the academy, and it depends on the idea of the board, the director board of the academy of that. This is my idea, and that's what we hold in the Cuban, for example. Now we defined the control of the maternity and the control of the birth, every control of the birth of the children, and to decrease the mortality of the children during the birth. That is a severe problem, but it is not only the problem of the Ministry of Public Health, it's a problem of the society. Because, for example, it's very important to collect, there are three or four different organizations who have to be involved in the results. For example, the people who have to take care of the garbage and to maintain the city clean. This is very important to control all the vectors. It is very important. It doesn't depend on the public health, it depends on other organization of the government, it depends on the country, it depends on the system of the government itself and the attention that the government will play to some of these points. So I believe that one of the main things that the direction of the academy have to organize, which are the key points in which we have to work, and then to collect the people who have able to do that, and then we can do it in the better way. That's the way that we try to organize. I cannot say that we are doing a very good work. We are doing the best we can. But to say it's good or it's not good, it doesn't depend on us. It depends on the results of what we are doing.